This episode is for education and awareness. I'm not your doctor, I'm not your pharmacist, and I'm not your lawyer. I'm not giving you medical, legal, or financial advice. Prescription coverage, laws, and plan rules vary by state and plan. If something in this episode sounds like your situation, please talk to your doctor, pharmacist, and a qualified advisor before making changes. Now let's talk about the middlemen who are quietly deciding what drugs you get and how much you pay. Let me paint a picture. You've been on the same medication for years. Same dose, same pharmacy, same Medicare plan. One day, you show up at the counter and the pharmacist says, that'll be $164 today. You blink. Last time, it was 40. Before that, 10. You ask what has changed. The answer is sort of some mix of your plan moved to a different tier, the preferred drug changed, the plan wants you to try something else. None of those phrases actually explain why you suddenly are paying 4 times as much. Here is the unpleasant truth. Behind your doctor, your pharmacy, and your Medicare plan sits another player you almost never have heard about, but who has enormous power over all of this, the Pharmacy Benefit Manager, or PBM. The PBM, you didn't vote for them, you didn't hire them, you probably couldn't name the one that handles your plan. But they can decide which drug you get, how much you pay at the register, whether your local pharmacy survives, and ultimately whether you can afford to stay on the medications that keep you independent. This episode is about them. This is Pharmacy Middlemen, how PBMs are bleeding seniors and threatening their independence. Most seniors think their prescription world has 3 players: the doctor who writes the prescription, the pharmacy that fills it, and the insurance or Medicare plan that covers it. However, there is a 4th player sitting in the middle of almost every transaction, and that player is the PBM, or Pharmacy Benefit Manager. Actually, on paper, PBMs negotiate drug prices, build formularies, that is the list of drugs your plan covers, processes claims and pharmacy payments, and supposedly saves money for health plans, employers, and the subscribers. Well, that's actually the brochure version. So what is the reality? The reality is that PBMs are actually giant middlemen who control which drugs are favored, which are punished, and how much money moves around in the system. They make money through a maze of rebates, fees, and spreads, which you never see. A handful of these huge PBMs, believe it or not, handle most of the market. So if you are on Medicare Part D or a Medicare Advantage plan, for example, odds are your prescriptions go through one of the PBMs. Let me say something now is very important for us to understand. The PBMs do not work for you. Let me say it again. The PBMs do not work for you. They work for themselves and the plans that hire them. And because they're in the middle, they can quietly shape your drug costs and your treatment in ways that directly hit your health and your independence. Let's talk about the rebate game, because this is where a lot of the damage happens. Here's the basic setup. A drug manufacturer sets a list price for a medication, which, by the way, is already sky high. The PBM goes to the manufacturer and says, if you want your drug to be on the formulary, and especially if you want it to be on the preferred tier, you will pay us a rebate on every prescription we run through our system. The manufacturer agrees and often keeps the list price high or raises it. The PBM collects those rebates. Plans and PBMs talk about savings, but seniors see higher list prices, high coinsurance, because it's a percentage of the inflated price. Chaos when a different drug suddenly becomes the preferred one. The incentive for the PBM is not lowest prices for seniors. The incentive is the biggest rebate from the manufacturers. So instead of the safest, most affordable drug being favored, you get drug choices influenced by who pays the PBM the most, not what's best or cheapest for you. You pay in the form of higher copays, higher coinsurance, higher premiums, and sudden, unexplained changes in what's covered and what isn't. Meanwhile, the PBM and the plan brag about discounts in their reports. You don't live in their reports, you live at the pharmacy counter. PBMs help design and enforce the formulary, which is a list of drugs which your plan will cover and under what conditions they will be covered. They use three main tools for this. Tiering, in which they sort drugs into categories, from the cheapest to the most expensive, okay? Or things like generics, preferred brands, non-preferred brands, specialty, and so forth. Those requiring prior authorization, the plan requires special permission before it will pay. Step therapy. You must fail on cheaper drugs first before they'll cover the one your doctor recommends. For seniors, this sounds like that drug requires prior authorization. Your plan wants you to try the others first. That medicine's not on your formulary anymore. Your doctor will have to switch you. What it really is friction, delay, and hurdles. Some people give up. Some doctors switch you to what the PBM prefers. Some patients go without for a while. For an older adult with multiple chronic conditions, it's not a small inconvenience. That's blood pressure out of control. That's diabetes not being managed. That's joint pain so bad you stop walking and lose independence and confidence. It's called utilization management by them. I call it make it annoying enough that some people don't get the drug. The PBM doesn't know your name. It just knows that every person who gives up saves them and the plan money. The next topic is spread pricing. Here's what happens when it's being used. The PBM tells your plan this drug costs X dollars, and then it pays your pharmacy at a lower rate. We call it Y dollars. The difference is the spread. X minus Y is the money that the PBM keeps, and you never see those numbers. How does it affect you? How does it hit you? Your plan's costs are higher than they need to be, which feeds into premiums and the overall cost structure. Local independent pharmacies get squeezed hard. They're being underpaid for the work they do. Some of those pharmacies eventually shut down or drop certain plans because they can't survive on the PBM payments. And what do you see? Your trusted neighborhood pharmacy closes or stops taking your plan. You're pushed to big chains or mail order that the PBMs like. The PBMs call this managing the network and providing value. From where we as seniors sit, it often looks like fewer choices, longer drives, less personal care. Many PBMs are literally tied to big brand name pharmacies or even their own mail order operations. That gives them another lever, so-called steering. They design plans so that preferred pharmacies, often ones that they own or control in some other way, have lower copays. Non-preferred pharmacies, including independents, will cost you more if you go there. They heavily push mail order. You'll save money if you use our mail order pharmacy. Your copay is lower at this chain. Sometimes there are real savings, but let's be honest. Preferred often means preferred by the PBM's wallet, not best for your health and independence. For seniors, this can mean losing the pharmacist who knows your history and catches errors, more delays, lost shipments, and confusion, yes, with the mail orders. Less ability to sit face to face with a professional and ask, is there a cheaper way to do this? For someone on 8, 10, 12 medications, that level of disruption can directly hit safety and independence. Let's connect the dots now. PBMs love to talk about cost management and efficiency. Doesn't that sound nice? On the other side of the coin, for seniors, the impact is much more straightforward and simpler. Higher out-of-pocket costs means some people stretch doses, cut pills, or skip refills. There are treatment delays and forced drug switches, which means your medical conditions may not be controlled. Then there are the pharmacy closures and network games, meaning that the seniors lose personal guidance that they had relied upon for years. Confusing plan changes means older adults and caregivers just throw up their hands and accept whatever they're told at the counter. All of that lands directly in the health and independence bucket. If you can't afford the drug that keeps your heart working, your lungs open, your pain controlled, or your mood stable, you will lose mobility, energy, confidence, net, the ability to live on your own terms. This isn't just about dollars. It's about whether you can keep living the life you still want or whether the system quietly pushes you into decline. You're not going to personally reform the PBM industry, but you can stop playing this game on easy mode for them. Here's what is actually within your control. First, don't confuse preferred with best for you. When a plan says preferred drug, preferred pharmacy, translate that as preferred by the plan and PBM financially. Always ask, is there a generic or different drug that would work just as well but cost less? Is there a way to move this prescription to a lower tier? What would this cost at a different pharmacy? Sometimes a tiny change in the drug or the pharmacy saves you real money. Secondly, use your pharmacist as an ally, not just as a cashier. A good pharmacist sees PBMs nonsense every single day. So they are experts in their operation. And ask them, is this really the cheapest option for me? Is the plan blocking something that you and my doctor think would be better? Are there other ways to fill this prescription that might cost me less? They can often suggest alternatives your doctor can prescribe that dodge some PBM roadblocks. Number 3, treat Medicare drug coverage like serious business at the open enrollment period. Do not just stay in the same plan because it's familiar. Okay? Pick based on not on TV ads and zero premium marketing. Most of the time, it's not quite true. At open enrollment, make a list of your actual medications, names, doses, how often you take them, and other details. Check how each plan covers those specific drugs. What tier are they on? What pharmacies are considered preferred? Whether the drugs require prior authorization or the step therapy. If you don't want to do this alone, get help from a trusted counselor, broker, or family member who will actually look at your drugs, not just shove you into whatever plan is easiest for them. The fourth, don't fight prior authorization and denials alone. If you don't have to. If a drug is denied, the PBM demands step therapy, you're stuck in a paperwork loop. What you want to do is for the doctor to be willing to push back. A family member or caregiver who can call the plan, help with forms, keep track of who said what and when. PBMs count on you being tired and overwhelmed. Do not give them a solo opponent if you can avoid it. This has been a rather long podcast, but it's a critical topic. To wrap it up, I'm going to be blunt, if you haven't noticed that before. If your drug costs don't make sense, if your coverage keeps changing, if you are being told to bounce between drugs you know don't work for you, you're not crazy, my friends. The system is. A lot of what you're experiencing is not bad luck. It's the logical result of a structure where middlemen get paid more when list prices stay high and the rebates flow. Plans and PBMs use friction, prior authorizations, step therapy, network games to slow down spending, their spending. Seniors, especially those without strong advocates, are the easiest people to push around. You did not design this, but you do have choices. Ask more questions. Use pharmacists and family as allies. Take open enrollment seriously. Push back or get someone who will. Push back for you when the plan's rules are sabotaging your health and independence. Do not just depend on your body. There are limitations. The demand on whether you can get the medications that keep that body functioning without going broke or giving up. Pharmacy benefit managers might be invisible on your pill bottle, but they are absolutely not invisible in your life. The first step, indeed, is knowing that they exist. The second is refusing to be a silent, confused customer who just pays whatever shows up on the register screen. Information plus knowledge equals senior power, which is our motto or tagline. Use it when you walk into the pharmacy. Use it when you pick a plan. Use it when someone tells you that's just how it works now. It isn't just how it works. It isn't just how it works. It's a setup. And now you can see the strings.